Hey guys, I'm Jessica, and I am a little bit sick, so if I cough or sniffle or anything, I do apologize. I can't control it. So the issues that our students face are some of the same issues that we faced. Bullying, poverty, teen pregnancy, homelessness, and abuse are some of the most common issues that have been around forever, and honestly probably aren't going anywhere anytime soon, though that is very sad. There are new issues like online bullying, specifically pictures, that is a big one, and being told to kill yourself is also a big thing with online because people think there are no consequences when you say something online. Though those are big issues, I want to talk about something that's a little bit more in my everyday life. I work at a high school, and so I do see this issue a lot, and that is teen pregnancy. I see so many girls at my school that are pregnant, and even when I was in school, I went to a school with a high rate pregnancy, so I knew girls even in middle school that were having babies. It's very common. I'm sure everybody knows somebody that had a baby in high school, but even though it is very common, statistically speaking, rates have dropped significantly from the 1960s. It used to be about 90 girls in 1,000 would be pregnant in high school in the 60s, and now that number is less than 20 per 1,000. So I do want to specify by saying that these numbers are from 13 to 18. I do try to keep it in between 13 and 18 because there are a time when you are out of high school and you can get pregnant, and that's perfectly fine, but I just want to keep this within the middle school, high school range. So these numbers are just for the pregnant women and not for the father. And they usually are 13 to 18. So although this has always been an issue and the rates have dropped, there really is no significant reason. The CDC claims that it could be because more children are refraining from unprotected sex. Some say that condoms are more widely available, and some say abortions are more popular than ever. But there is really no reason. There hasn't been that many studies on it. So some of the reasons that a girl may get pregnant in high school is because of her family's social economic conditions. She could be low educated, and she could live in a low income household, possibly on welfare, or in the foster care system. Girls in the foster care system are twice as likely to get pregnant in high school than a girl that's not in the foster care system. But speaking in statistics again, fewer 15 and 19-year-olds are participating in sexual intercourse. Most are starting older and only having a few partners in their life. But that being said, the use of birth control is still shockingly low. It's only about 15%. And although that number is up from previous years, it's still way too low and can cause issues with the teen. So some say that the reason that birth control numbers are so low is because a lot of people are too afraid to ask a parent or guardian to take them to the doctor to get birth control. But speaking of being afraid of the doctor, most adolescent mothers do have health problems in their pregnancy, and they will not check into a doctor until at least the second trimester, when people can start to see that they're showing, or they know for a fact. So not only can that hurt the mother's life, but the fetus as well. According to the World Health Organization, complications during pregnancy and childbirth are the leading cause of death from girls 15 to 19 globally. And adolescent mothers 10 to 19 face a higher risk of preeclampsia, endometriosis, and infections after the baby is born. But babies that are born to mothers under 20 have a higher risk of a low birth rate, preterm delivery, and severe neonatal conditions, and possibly have to spend time in the ICU. Children of teenage mothers statistically do worse in school, and they achieve lower than somebody that was born to a parent older than 20. They also can have their own health problems, statistically are more likely to be incarcerated as a teenager, and can face unemployment problems as an adult. According to the CDC, although the birth rates have declined in most racial groups, the highest number is still American Indians. That number is almost at 35% of Native American teen girls getting pregnant in high school. The lowest is Caucasians, and that is 13%. Everything else kind of falls in the middle. So social consequences can also be very harmful to a unmarried pregnant teenage mother. There's the stigma around being pregnant in high school. There's always the rejection. You can face violence from a parent once they find out, or a partner. Girls who become pregnant before the age of 18 statistically are more likely to end up in a violent marriage. And adolescent pregnancy and childbearing often leads girls to drop out of school. Although efforts are underway, and in some places have worked very well to enable them to go back to school after childbirth, this can jeopardize the girl's future and her employment opportunities to provide for her families. Most schools have implemented a family life class. Some places call it a FACS class. Some it is sex education. And this is required curriculum anymore. And it's kind of just scaring straight. It is science-based, which is very important. And it's pretty much talking about pregnancy, how you get pregnant, STDs, risk factors, things that can happen after you have the baby, and how hard it is to raise a baby. You can also have baby simulation dolls. And in most places, this is a required thing you have to do while you are in high school. And that is just a robotic baby that cries, screams, acts like a real baby, and that you have to soothe. And usually that's a take it home for the weekend type of thing. But most curriculums do require a sex ed and like a family course. Good touch, bad touch when you're in elementary school, and typically pregnancy and STD risks in high school. But it has been proven that abstinence does not work, and that issue is being pushed on teenagers again, although science-based learning has been working, and I will get into that in just a minute. So according to the Office of Population Affairs, the government programs that help reduce adolescent pregnancy are many. There are so many. The Teen Pregnancy Prevention Program is probably the most common, and it's by the Department of Health and Human Services, and it's for target groups of adolescents with a high risk, and it teaches about sex ed and pregnancy prevention. Because of these programs, according to the website, it says that there are fewer teen pregnancies. The Pregnancy Assistance Fund funds a support network for mothers. It's not just pregnant mothers that are adolescents, it is just all mothers, but specifically adolescents, it teaches them a little bit more. The money that goes from that is for teaching about the prevention methods. So other tactics that the CDC recommends is a science-based approach and teaching and training assistant to tell the local people, like your local sex ed teacher, how to do a science-based program. And there has been more than $100 million put into the Teen Prevention Pregnancy Program to help with those. And that is at a community-based level, but it is a grant program from the government. There's a process called the Promoting Science-Based Approach to Teen Pregnancy and Prevention using Getting to Outcomes. And that is also another government program, and is put over $75 million into helping adolescents. So what I was saying earlier about them wanting to dismantle the idea of science-based learning. In April, the Trump administration tried to change the Teen Prevention Pregnancy Aid program and fund it with a program that would just pretty much say only abstinence is the answer. The direct quote says that teen sex is a risky behavior, as it will teach skills to help those youths already involved in the risky act of sexual behavior and return them to a risk-free choice in their future, end quote. And that pretty much is just saying abstinence. But under the Teen Prevention Pregnancy Program, those grants that have been out into the public, almost $100 million, they go to states, nonprofit organizations, schools, universities, and other projects that can help. The Family and Youth Service Bureau of Administration and Children and Families, so the ACF, also oversees the Personal Responsibility Education Program, or the PREP program, and that's part of the Affordable Cares Act, and that is also another program that has given somewhere between $75 and $100 million to educate adolescents not only on abstinence and contraception, but pregnancy in general. So about half of teen mothers choose to keep their babies after they're being born, and they choose to do that to sacrifice their education, at least for a couple of months while they're pregnant, and maybe shortly after giving birth. According to the social work today, only about 50% of teenage mothers graduate from high school before they're 22. Preventative programs have changed that, and they work very hard to totally diminish the idea that a mother couldn't go back to school. It's already challenging enough in itself to be a new parent, especially as a teenager when you're dealing with all the stress. Denying them their right to education would just make their lives harder. Although, in recent years, this desire to return to school and create a better life for them and their child is brand new. These women are not just experiencing a life-changing moment of having a new baby, but they're adjusting to the new challenges, and they learn how to juggle the struggle. And then they will go back to school. And most continue their career and have a higher education degree. These mothers continue their school during pregnancy and return shortly after birth. With the support from the loved ones, they can get back faster than ever. So when they reevaluate their education goals, it pushes them to a higher incline education. So most go back to college as they dream of a brighter future for themselves and their babies. The teen pregnancy factor is huge in dropout, though. About half of teen mothers receive a high school diploma by 22, and normally that's about 90% of teenage girls receive a high school diploma before the age of 18. Or 18, 19. So the options that you can have, other than keeping your baby, you can choose to have an abortion, you can choose adoption. Those are the main three: keep it, abort it, adopt it. And if you choose to keep it, there are programs to help. There are places like Planned Parenthood and Birthline that can help with the idea of abortions and the effect it has on your mental health. And adoption is always huge. People love to adopt babies. It's probably the most adopted child is a baby. People don't typically want older ones. But most choose to keep the baby themselves, about half. Even though those can be challenging, there are many programs that can help them. And in the end, it's all about the support system. Thanks for listening, guys. Have a good day.